Hi everyone. My name is Yash Bhausar. I'm Director of Solutions at Persistent Systems. And we also have Vinay and Ajay here. We are going to help you out through the hackathon. What we are going to...
See if everyone is here.
Yeah, are we expecting a few more people? Shall we get started? Okay. So what we are going to do here is we are going to show you art of possibilities of Health Cloud. So the first part of our demonstration, which will be around 5 to 7, 10 minutes, is on what Persistent does on top of Health Cloud, which actually is very centric towards individualized health plans and all. So something which is which you can think of in your solutions. So many of you might be thinking like, what is Health Cloud? How I can use it in my proposed solution? How Health Cloud can be used? And the second part of our demonstration would be Vinay will show you what kind of org, Salesforce calls it the environment, the development environment as org. What kind of org will you get, and how to log into that, and where do you find objects and fields, if at all you have to tweak those. So let's, without further ado, let me quickly show you. So this is a customized view of a care coordinator who is managing a set of patients. So if a care coordinator has, and again, this is not directly related to pain fatigue, but what we are looking at is that throughout the data which you are capturing from, maybe it is multiple devices, wearable devices and all of this data can be pulled into Salesforce, and then you can create individualized care plans, and we'll see what does it mean by that. Before we go there, let's quickly take a look at the other things, the analytics piece, the risk assessment or risk stratification, what Salesforce could do. So you can get all of these data elements, pain-related, fatigue-related data elements, and if at all you want to create some algorithms on top of it to identify some risk levels, you can do that. This is another way of looking at a task-oriented view of what you can do in Salesforce. So basically what happens is that you bring all of this data, and then you set up tasks that if this is what is happening, then I want this person to be notified. I want this action to happen. So something like an automated workflow. So this is one way of looking at it. You can also assess it on a calendar so that this calendar can be accessed by patient or a caregiver, or caregiver as in the patient's family, or also by the care coordinator. Most of this data is expected to be used not by the physician, but everybody else, because physicians, we still expect them to do things inside EMR. You have seen some of this earlier in the screenshots which Murad has shared. This is a patient's view in Health Cloud. The art of possibilities is that this particular piece, it actually gives you a list of tabs which you can open. And here on the right-hand side, I'm showing this. So this is a patient's profile. So you can create, similarly, similar to patient, you can create profiles for all the actors who are involved in the process. So what we are looking at is setting up a profile of a patient. So if you look at this, you can set up the way it is activity history. You can set up patients' visits, patients' events which are happening through their wearable devices. You can capture some of those things. If at all you are the conditions patients have, you can set those things up. And we have been talking about integrating data with data which is coming from other hospital systems or other players like HIEs. So all of this data can be driven by external hospital networks or systems or HIEs. For example, if you look at all of this data, the cases, referrals and all, what you can think of is how you can enrich a patient's profile by looking at the communication you have, address, dashboards, the kind of activities which are planned specifically for this particular patient. The other piece which you may have seen, if at all you are setting up a team to take care of this patient, again, we are coming back to treating the illness. This is not part of population health, but more of individualized care plan. Then you can set up, and you can see that you will have an access here to add a member, and you can identify what kind of role you would like to have for that particular member. So you will see that some of these things is available for you out of the box. You can see that you in your solution, if at all you are thinking of coming up and having this illness being treated when multiple people, but all of them may not be clinical, this is one good way of setting it up. And another way of setting it up is you can plan that based on the data, again, we are completely focusing on patient right now, that based on this data, you can set up some of the health or clinical tasks and clinical goals. For example, if at all is a cancer patient or a cancer survivor, what kind of things you can do ensures adherence to pain. You are following up after some particular given amount of time. If at all there is discharge management and you need to do patient education, then in that case, what are the things you need to do, due date, who is expected to do it, if there is an external person who can do that. So the reason I'm showing all of you this is that you can think of this as your template, whether it is a care plan which you want to set up or some workflows you want to set up, and it doesn't have to be clinical in nature. So if at all you are thinking any of those things in your solutions, you can leverage Health Cloud for that. Another thing, the other piece which I was trying to mention is the patient 360, which Murad was talking about. Now these particular, let's say, immunization records or allergy intolerance records or EHR conditions, you can expect all of these conditions to come from multiple sources. And you can think of running algorithms on top of it so that it gives you risk assessments, or you can think of triggering some notifications so that who are taking care of the patient can be notified and action can be taken on top of it. We have been talking a whole lot about wearable devices. You saw an example earlier this evening. This is how it can look inside Salesforce. This is a Fitbit integration, and this is live integration. So you can think of this, that how exactly it can be integrated inside Health Cloud, how it may look. And based on this, can you see down below here, that based on this, you can actually trigger some workflows. So you can also think of those things inside Health Cloud. Of course, this is not available to you out of the box right now, because this is something which specialized from our team actually improve on top of Health Cloud. But I'm just giving you an idea of what you can think of. Now, if at all you are thinking in terms of taking this individualized care plan and running it for multiple other places, then you can think of some other applications. This is one of the applications which actually goes in the out there on the internet and gives you back some results. Another piece is, as I already talked about, is running risk stratifications. You can think about running multiple such, whether it's SINAIMedMaker or some other models. You can incorporate those models inside here. Now, so this is basically out of the what Persistent has been doing, but based on the feedback and the sessions we had, we saw some MRI scans coming in. I don't know if you guys are aware of the newer machine learning technologies, especially deep learning. What it does is it can go through those particular scans rapidly and can identify some of those things, so that there is a ready-made thing available for the clinicians to look at it and then take care of it. Some of that deep learning can actually run on in addition to Health Cloud, where you pump all of this data in Wave and run that. So that is one thing. We talked about wearable devices. And the same mechanism which you see can also be applied to run clinical trials. So that is also another thing. Then we also saw mindful training by some people. There was a discussion around that. Basically, it is similar to running some kind of service for patients. So if you are thinking of running and getting inputs from patient, and you are thinking, how can we do that? So Salesforce Health Cloud is a good tool where you can give access to your patient and run these surveys on tablets, and you can get inputs out of this. So these are some of the examples of what you can do on Health Cloud. Before we show you what we have set up for you in Health Cloud, are there any questions I can answer real quick? So let me answer. The question is, can you access data via RESTful APIs? The answer to that is yes. And I will elaborate that in one more layer. So if you see, these are the inputs. Now, I don't know how many of you have heard about a concept called as data lake. So this is this immunization record, for example, or medication prescription actually is coming from a data lake where all of this information is being dumped by HIEs, and on top of it there is a Fire API layer. So this Salesforce is Fire enabled, Health Cloud is Fire enabled, for those who are aware of this particular thing, and you can get this data in. There are other ways of getting data in as well. So this Fitbit data is actually you're connecting to Google and getting that data. So Fitbit is not being directly connected. Fitbit dumps data in Google, and we get that data from Google. So there are multiple ways. In your solution, you can assume that Salesforce can connect to any system, or Salesforce or the Health Cloud can connect, and if at all there is an interface required, and it's very specific, you can count on technology company like Persistent to develop that. So don't. Does it answer your question? Sorry, long answer. Okay, so let's quickly take a look at, let me introduce Vinay here. Vinay is, he's an architect, and he'll explain us that what comes out. Please.
Just one thing to add on top of what Yash said about the integration. So Salesforce is REST and SOAP. It accepts both protocols. It's a primarily JSON object. This is as far as the integration is concerned. Also, you can get your authentication done using LDAP. It supports both SP and IDP. So you can integrate your AD or any other, for your example, your Google also can be used to authenticate the users. Now coming back to, Yash has already covered a lot of things, almost all the aspects. But there is one thing which Yash didn't cover, is this health timeline. So this is one of the features you will get in the environments which are configured for you, or which will be configured for you in next 1 hour or 2 hours. Primarily it shows, you can select the type of events over here. Sorry. You can select the type of events. So these are the events which we are capturing from the patient information and displaying over here. The basic idea, if you are trying to build a solution, you need to understand one thing, which is a very simple concept from a database point of view. Everything which you see in Salesforce, you can consider or map that with a single row in an Excel sheet. Every worksheet in an Excel corresponds to an object in Salesforce. Every record in an Excel corresponds to a record in Salesforce. So as long as you are adhering to that particular structure, you can build anything in Salesforce, and on top of that, there are multiple ways of building a UI layer. And it's all HTML5, and it's device agnostic. Now coming back to what you will receive. Reports and dashboard, which Yash showed earlier, you won't be able to see those. These are the 4 options which you will see. If I go to dashboard, this is the pretty basic, simple skeleton dashboard which you'll see. What we have built is a customized one, but that was just to show you that what kind of dashboards can be built or what kind of analytical power can be built over Salesforce. Now coming to how you will receive your logins. Once you have formed your teams, you would have to provide your name and email address to me. I'll configure those users in different environments. So we have created 20 different environments, one for each team. Once the user is created, you will receive an email. You have to verify that this is your proper email address. And after that, I'll set up the password, which you can use from tomorrow morning. So I believe the team formation has already started. So as soon as you guys can provide me information, I'll start configuring those. Any questions? Please feel free to ask. Yeah. Can you speak up?
Say insurance integrations, so be able to pull from the top.
Right now, in next 2 days, I don't think you would be able to create the actual integration piece, but you can create the, on a conceptual level, you can create that. Whenever you have a solution ready, you can showcase that. The only thing which you need to confirm, we would be here tomorrow and day after that, is just come to us and let us know that what kind of integration solution you are trying to build or what you're thinking, and we can confirm whether it can be built or not. And as I said earlier, REST, SOAP, both are supported. JSON format, and even if you want to do authentication, IDP and SP both are enabled.
So one just wanted to add. One recommendation I would have is whatever data you're expecting from insurance, for example, if player is going to give you this data, you just build those as fields in the format you want, and we can simulate that. Okay, this is the data. Let's expect you hit this button. We are going to pay. Getting this data. This is what. So you can simulate it.
I didn't get, was there an email that you said this is the username and password?
Yeah.
I just need the basic login, so I can create an account or a user under the account that's outside that thing. I just didn't get that information.
So once you have provided your email address to me, I'll put that email address in the system, and you will receive an email from Salesforce support that this is your login ID, and you have to verify your email address. Once you have verified it, your user will be created. It will give you an option also to set your password, and if you find any problem with that, you can come to me. I'll reset your password and provide it to you.
It's fairly simple. The way we log into Gmail or Facebook, it's login.salesforce.com, and your email address and the password is going to give you, and that's how you log in. And this setup will be ready.
Other thing which you guys might want to consider is that whenever you are thinking that this is the type of information which we want to create in Salesforce or capture in Salesforce it is pretty easy to create those fields, build your own page layouts, build your own workflows also. So whenever you are defining the solution or building any solution, do not constrain yourself from the technology point of view. So the Salesforce platform you will be able to build all those things in Salesforce. Any more questions? You wanted to add something?
Thanks very much, guys.
Thank you.